Eredo, Mrs. Kumilayo, Adelaja, Ekujoko, Ekutoju Chairman. The man is growing faster every day, and that is why he's being fed, and that is the reason. That is to say that this woman has been performing her duty effectively, feeding the chairman both day and night. God bless you. Láti ilé ìgbìmọ̀ aṣòfin ìpínlẹ̀ Èkó, advisors as well as special advisors from Ẹ̀pẹ́, wọ́n ti ẹ̀pọ̀ ńbẹ̀ yẹn, wọ́n pọ̀ ńbẹ̀ mo ti rájọ̀rọ̀, mo rí environment Yusuf, mo rí ẹni tó ń bá wa gbowó wọlé, ìyẹn Défìlà Brown lọ́ọ̀kan, ó wà in charge revenue fẹ́ pẹ́, ó kì í yóò torí lọ yẹn, thank you sir. Jẹ́nu ẹ̀ lágbára náà wọ́n ní fífi sí ìránṣẹ́ sí nígbà tó bẹ́ẹ̀ náà bá jìnnà torí táwọn ọmọ ilẹ̀ ṣe ń ṣe wàhálà ọ̀rọ̀ àjẹkẹ́ jèrè àwọn ọmọ náà a kí ilé ẹ̀kọ́ sí ẹkú jòkó ẹ̀kọ́ àtàárọ̀ ṣẹ́rí ńgbà mi ó máa ń ṣòro fún wa láti lè dárúkọ lọ́gbẹ́jà níta bẹ̀bí kó lè kárí gbogbo èèyàn ìṣòro púpọ̀ nítorí pé.
ẹ bá mi sọ fọ́lọ́ ilé àti ìṣòro sọ fọ́lọ́ ìjọ ìlú o wọ́n ti ṣoríire o ìgbà rẹ̀ ń tù wá lára. Ọmọ Fáṣọlá àsìkò rẹ̀ ń tù wá lára àkànní. Ìgbà rẹ̀ ń tù wá lára ọmọ Fáṣọlá àsìkò rẹ̀ ń tù wá lára àkànní. Àbújá wa rèé, Èkó ní ìbàjẹ́ láyé o. Àbẹ̀rẹ̀ sára mi lọ́jọ́ fọwọ́ wẹ́wẹ́ dání èṣe pàtàkì.
Ṣé wálẹ̀ díẹ̀? Ramadan lọ́ba oṣù o, ìlàtìká lọ́ba òru o. Ìmáàmù láṣíwájú mùsùlùmí o, ìmáàmù ni bàbá ọba o, gbogbo ìmáàmù pàápàá lápẹ̀tùlẹ̀, gbogbo àwọn tẹ̀lédò láì jẹ́ nìkankan sí, gbogbo àwọn ìmáàmù tó wá akínlẹ̀ ẹ̀kọ́ tó wà bá ìmáàmù wa kò sàlámù aláìkùm warahmatullahi wabarakatuh ẹkú ìdíje ọlọ́wọ́ adúrótì. Kánjà lẹ́yìn eléyìí wá lọ́dọ̀ ọmọ ìyá lọ́jà lápapọ̀ torí pé àwọn ni abiyamọ tí wọ́n wò wá dàgbà. Mú àárín ọjà ló wà, fílẹ̀ àárín ọjà ló wà, mo kí yín o.
Gbogbo ìbàdàn bá wá ṣàkíyèsí ọmọ òyìn nínú ìyá dáadáa àyà tètè bá lóòrùn mọ́ àti pé kó lóyún máa sí nínú àwẹ̀ fún òun láti lè máa ṣàyẹ̀wò dáadáa bí ìgbà mẹ́ta bí jù bẹ́ẹ̀ lọ ìlú mi ní ìka òkè. Àbíyé mi ò máa fi ó. 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 Aláboyún ìpínlẹ̀ òde òun sí o. Aláboyún ìpínlẹ̀ òde òun sí o.
Gbogbo àwọn ọ̀yà lọ́jà àwọn alápapọ̀.
Èyí lẹ́gbẹ́ òdò bí mú ẹ̀ jáde, ọmọ làjà wo ìwọ ló.
Dr. Abájídé Sado, owó kọ̀ọ̀sà.
Ọmọ làjà wo. Oyin bàbá mọ́yàwó èyí lẹ́gbẹ́ òdò bí mú ẹ̀ jáde. Bàtà bọ́ọ̀lì ń bẹ lẹ́sẹ̀ wọn o, bẹ́ẹ̀ni ìdá èsì ẹ̀. Bẹ́ẹ̀ni ìdá èsì ẹ̀. Bẹ́ẹ̀ni ìdá èsì ẹ̀. Ẹ̀wù abọ́ọ̀lì wà lára wọn, bàtà bọ́ọ̀lì ń bẹ lẹ́sẹ̀ wọn o, bẹ́ẹ̀ni ìdá èsì ẹ̀. Sàlú ọlọ́nà bí kàrí. Gbogbo ọlọ́jà kú ìdèlé. Gbogbo ọlọ́jà kú ìdèlé. Ọmọ ọlọ́yà àtìkú tí mú lọ. Ọmọ ọlọ́jà jẹ́nẹ́rà àtìkú tí mú lọ. Gbogbo ẹgbẹ́ kú ìdèlé.
Chairman Eredo, tí o mọ̀ pé ní nǹkan tó dáa tó báyìí, ìjọba ẹ bá fẹ́ ṣe property celebration, ẹ má wulẹ̀ ra gbogbo àwọn mọ́sílì rọ́ṣọ. Kíni tọ́wọ́ wí ẹ̀jẹ̀ tàbí ṣiṣẹ́, àwọn ìyá wa yìí, musical instrument ní kẹ́ra fún ọ.
Ọ̀bàlùwà dámọ̀ rẹ̀ sí. Ẹyin kúrò máa ṣe bàjẹ́.
Dr. Mọ́sẹ̀yìndé mi, ẹ káàbọ̀ sílé ìwé wá kí àwọn kábíyèsí o. Dr. Mọ́sẹ̀yìndé mi, ẹ wá tọ̀wọ̀ kábíyèsí o, ẹ káàbọ̀ sílé o.
Ó gbẹgbẹ́ kú yìí. Ìyá ọlọ́jà jẹ́nẹ́rà tí kú tí mú lọ. Ìyá ọlọ́jà jẹ́nẹ́rà tí wọ́n lọ sọ̀rọ̀ wò. Ó gbẹgbẹ́ kú. Ó gbẹgbẹ́ kú ìdèlé. Ọmọ ìwà ọmọ rẹ̀ sí. Àdùgbà ojú òsì wá o. Àdùgbà ojú òsì wá o. Ṣé lórí ọmọlájà t'Olúwa fún wa? Ṣé lórí adélájà t'Ọlọ́run fún wa? Ó ṣe fóníyé, ó ṣe fàlejò, gbogbo ojú lórí. Àdùgbà ojú òsì wá o. Àdùgbà ojú òsì wá. Àdùgbà ojú òsì wá. Tiwa o. Ṣé lórí ọmọlájà onílé ṣe fàlejò, gbogbo ojú lórí. Àwọn tó wọ́n lẹ́yìn ẹ̀ gbogbo wọn rí jẹ́ o. Àdúpẹ́ tójú ó ti wá. Àdúpẹ́ tójú ó ti wá. Mo ti lọ́lọ́gà, èmi ò rí Rúsàbíù yìí rí. Mo ti lọ́lọ́gà, mi ò rí Rúsàbíù yìí rí. Àtọmọdé àtàlágbà, ó gbà gbogbo wọn sí iṣẹ́. Ètò ẹ̀kọ́ ògbẹ̀yìn, ó tún ń tọ́jú arúgbó. Ètò ìlera ògbẹ̀yìn, ó tún ń gbé yẹn káàkiri. mo ti ọlọ́dà tún pa òun abẹ́ lọ́lá olúwa. Inú mi máa ń dùn bí mo bá rí tàbí òun ní tèmi. Inú mi máa ń ayẹlẹ bí mo bá rí tàbí òun ní tèmi. Ọmọ ayé ẹ̀dá o àwọn ọmọ kò dání. Ọmọ ayé kò tá o ẹ̀yẹ́ máa ti fò lọ bá ọ. Inú mi máa ayẹlẹ bí mo bá rí tàbí òun ní tèmi. Adára. Lọ́lá olúwa. Fún mi láyọ̀ wé máa ra òun ọmọ rẹ̀ o. Ṣé àtẹ̀síwé máa ra òun nítorí àgbèrè láàárọ̀ òkèlè àkọ́bù eré àrùn ọ̀gẹ̀. Fún mi láyọ̀ wé máa ra òun. Fún mi láyọ̀ wé máa ra òun ọmọ rẹ̀ o. Ṣé àtẹ̀síwé máa ra òun nítorí ẹwé lẹ́fọ́ gbà o lọ́jọ́ jíjẹ lọ́jọ́ mímu ẹwé lẹ́fọ́ gbà o ẹwé lẹ́fọ́ gbà o ọba ọba láṣẹ ọba 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 láṣẹ ọba kí là ń fọ ọba pè kí là ń fọ ọba pè ọba tó tó bí ààrẹ ọba tó mẹ́wù òkè kí là ń fọ ọba pè. Ajọ́ síbi tó ń rẹ̀ ẹ̀bẹ̀ oríṣiríṣi.
Kábíyèsí o.
Kábíyèsí o.
Ẹni tó tẹ̀lé wọn ní kábíyèsí ọba ẹ̀sìn Òdúkọ̀yà ọmọlá àti Òdúmọ́lá nìyẹn ẹ bá ń ṣe kábíyèsí o.
Kábíyèsí o.
Ẹni tó tẹ̀lé wọn kábíyèsí ọba Aliru Kọ́láwọlé Aládéwùrà ká tìlú Kóká.
Kábíyèsí o.
Láyé ìjọ wọn ní ọmọ Kóká arẹ́sẹ̀ nísìnyí kò rí bẹ́ẹ̀ ọmọ Kóká aeroplane ti rìn. Ẹni tó ń wọlé bẹ́ẹ̀ Chairman House Committee on Health láti Lagos House of Assembly Honourable Sùúrù Àfọ̀sẹ́.
Tí wọ́n ní wọ́n ń ṣe nípa ìgbàgbọ́ nínú ẹgbẹ́ wa ṣé bí bàbá rẹ̀ lónìí ṣàmárìn kómi àyàn fálẹ̀.
Ló tẹ̀lé wọn àwọn ní aláyẹ̀dẹ́lu ọ̀pọ̀dọ̀ àyọ̀dẹ́lu ọba jí àsùnmọ́ba lókun ìṣúná májẹ̀sí ẹ bá ń ṣe kábíyèsí o.
Kábíyèsí o.
Ẹni tó tẹ̀lé wọn kábíyèsí ọba Gàmọ́rù Ìṣọ̀lá Anímàṣàun Arólúgbadé ẹ̀ẹ́dẹ́gbèjì ọlọ́jà àjọpẹ́ fẹ́nà
kábíyèsí o.
ẹni tó tẹ̀lé wọn kábíyèsí ọba Túndé Ògúnlàjà aládéṣán ìjìnà foríjà ọmọ náà foríjà lágbàrí kan ẹyẹ fojú ọ̀run tòréré ọmọ ìta rẹ ẹ̀dá òkúta bá ń ṣe kábíyèsí o. Ẹni tó tẹ̀lé wọn Dùsọ̀yànù Ọlọ́fin Àjáyè ti ìlú Òrúgbò ọmọ Òrúgbò Ìdó Ẹgbẹ́gì ọmọ aboríbẹ́dá ó bẹ́dá bó kábíyèsí o. Ẹni tó tẹ̀lé wọn kábíyèsí ọba Adébúrà Alákejì ti ìlú Kétu ẹ máa ń ṣe kábíyèsí àwọn ọba aráyé lò. For those of us who want to run the protocol is as well. On that other side, we have the wife of the chairman of.
Lẹ́rìí yẹn, èṣù gbé wọn kò ṣeé gbé, màmá lẹ́rìí yẹn.
Lẹ́yìn tí wọ́n bàbá wa jí Ọláyẹmí former chairman Eredo bí wọ́n darí ìtọ́jú náà education tẹ̀lé bá ń fún ọ láti ọ̀tún àwọn olótẹ̀lé.
Bẹ́ẹ̀ni lídà ACN, ẹ jẹ́ ká pọ́n wọn lé. Bẹ́ẹ̀ni lídà ACN.
Please, shall we all rise with all due respect to welcome the Governor of Lagos State, His Excellency, Mr. Babatunde Raji Fashola, SAN, Governor of Lagos State.
ẹni tí à ń retí ó dé gómìnà ìpínlẹ̀ Èkó Babátúndé Rájí Fáṣọlá SAN. Ẹ jẹ́ ká tẹ̀wọ́ àtàríwó kí wọ́n káàbọ̀ náà kí n gbọ́ ariwo àtàtẹ́wọ́. Ẹ máa wọlé ọ, ẹ máa sọ pé káàbọ̀ ooo, káàbọ̀.
káàbọ̀ ooo, káàbọ̀. Ọmọ abílẹ̀ sọ̀rọ̀, ọmọ abílẹ̀ sọ̀rọ̀ kílẹ̀ lánú. Ó ti dé o, ó ti dé o, ó ti dé o. You are welcome, you are welcome, you are welcome to Eredo. We are greeting our governor. You are welcome to Eredo. You are welcome, you are welcome, you are welcome to Eredo. We are greeting our governor. You are welcome to Eredo. You are welcome, you are welcome, you are welcome to Eredo.
Shortly, shall we now take the national anthem, please? Rise, O compatriot, Nigeria's call obey, to serve our fatherland with love and strength and faith. Thy labor by heroes past shall never be in vain. To serve with heart and might, one name, peace and unity. God bless you. Please, shall we all take up? Mr. Babátúndé Rájí Fáṣọlá SAN, Governor Lagos State. Respected members of the Lagos State area, members of the CDAs here present, their mothers and fathers, the Iyaloja and Babaoloja here present, gentlemen of the press, distinguished guests, ladies and gentlemen. It is a pleasure once again to, on behalf of the Lagos State government, particularly the Lagos State Ministry of Health and the Lagos State Primary Health Care Board, to welcome you here today, the feet of the scholarship of the comprehensive flagship center, primary health center here in Eredo Local Council Development Area. Without much ado, we want to say we thank God for a time like this, as I please welcome for the opening prayer, the Chief Imam of Orabushi, Chief Imam S.A. Kazi, to please step forward very briefly to give us the opening prayer.
وقل الحمد لله الذي لم يتخذ ولدا ولم يكن له شريك في الملك ولم يكن له ولي من الذل وكبره تكبيرا سبحان الله والحمد لله ولا إله إلا الله الله أكبر الله أكبر الله أكبر ولا حول ولا قوة إلا بالله العلي العظيم سبحان ربك رب العزة عما يصفون والسلام على المرسلين والحمد لله رب العالمين. Oh Allah, the Lord of merciful, we pray to thee. We thank Almighty Allah, the Lord of the world, the owner of the peace. To you we bow, to you we worship, to you we seek for sustenance. Come us today, be with us here in this our program. Guide our noble governor, Fáṣọlá. May Allah continue to guide him ahead, and all his executive members. We also thank Almighty Allah who give us Sabit, Amelaja, Adilaja, who have been performing wonderfully in this area. May Allah continue to guide him. I also pray to all of us and chiefs here around, all the Iyaloja, and everyone here around. May Allah continue to guide every one of us Amen. Subhana rabbika rabbil izzati amma yasifun wa salamun ala al-mursalin walhamdulillahi rabbil alamin.
Next, without wasting time, is to humbly welcome our chief host and the chairman of Eredo Local Council Development Area, in the person of no other one but Honorable Sabiu Omolaja.
Mr. Babatunde Raji Fashola, SAN. Member of the State Executive Council here present. Member of the State House of Assembly here present. The former First Lady of Lagos State, Ebu Shakiru Adebanjo. Body of Permanent Secretary here present. Your Royal Majesty, Oba and Chiefs. The Chairman and member of Lagos State Primary Health Care Board. Member of the Executive Distinguished Guest. I feel highly honored to address you today on the occasion of official flagship of the Comprehensive Primary Health Care Center of Eredo Local Council Development Area. Today's occasion is a testimony of another landmark achievement in the transformational drive by His Excellency toward the delivering standard health care services to the people at the grassroots level and reducing the mortality rate in Lagos State. We are indeed very appreciative to His Excellency for extending his magnanimity to the good people of Eredo Local Council Development Area through the provision of this laudable healthcare facility. There is no doubt that Eredo Local Council Development Area has key into the attainment of Millennium Development Goal of Lagos State. Let me seize this opportunity avoided by this occasion to express our gratitude to His Excellency for creating job opportunity to our people through Agri-Cares program at Alaga, Epoka in Eredo LCD. The people of Eredo Local Council in the activities of public works corporation of the state agency, apart from regular maintenance of 5 primary health care centers in the Eredo Local Council, this administration has constructed another primary health care center at Procorida with ultra-modern scale laboratory equipment in order to make health care delivery accessible to our people. This project will be commissioned by September this year. It is significant to know that our administration intends to embark on 3 health mission program by November as contained in the 2013 budget. This will be second in the series. We have continually rendered supportive hand to our senior citizens, the old age, through regular payment of monthly allowance to them. Since Eredo Local Council Development Area is rural and not industrialized, there is over 420 pensionable staff. This administration employed 350 temporary staff of various cadres in the service of Eredo Local Council Development Area. We also distributed down form to indigent faced by their parents. Your Excellency, distinguished guests, ladies and gentlemen, as Oliver Twist, we are appealing to you, sir, to accept maintenance of some roads, such as Odoshuola Road, sir, Ojoda Ojoayo, sir, Imoku Road, sir, Oka Igodo Road, UP Iraye Road, Ilara Ibomo Road, sir, to mention but a few. Distinguished guests, ladies and gentlemen, we all agree with me that electricity has been a major problem in Eredo and Epe as a whole. It is affecting the lives of our people. Therefore, we shall remain ever grateful if His Excellency can come to our aid in prevailing of PACN in finding permanent solution to this problem. Your Excellency, sir, the residents of Eredo Local Council Development Area are suffering from acute water shortage. Our administration has sunk over 50 boreholes in the major streets and villages in Eredo to alleviate the problem of the people. It is still not sufficient. We are aware of your achievement in solving the water problem of Lagosian through the commissioning of ultra-modern water works spread all over the state. We will appreciate your Excellency kind intervention in resuscitating the water works at Okemagba to enable our people share from your generosity, sir. We are also requesting for special grant to assist the local council development area in preparing adequately for the coming rain, especially in the area of clearing and desilting our drainage and canals. Once again, I want to thank His Excellency for creating time to attend this occasion. I wish you and your entourage safe journey back to Lagos, sir.
I will now want to call on this woman who has been doing so much, and I mean so much. It all started, and this is the counting down, the feet of the sky, from Igadugano, Mosokola to Ajara to Itire, and now to Eredo. This woman is never tired. Please let's welcome for these very special opening remarks the special advisor to the Governor on Public Health, that's Mrs. Yewande additional Mama Dada one Shiribidibi.
Senior Advocate of Nigeria, I would like to privilege ladies and gentlemen and the great people of Eredo Local Council Development Area. With the creation of Lagos State in 1967, the Epe division was formed, which later became Epe local government, from which Eredo LCDA was birthed during the creation of the 37 LCDAs from pre-existing 20 local governments, which was in October 2003 by His Excellency Asiwaju Bola Ahmed Tinubu. The Eredo Primary Healthcare Center was built by the federal government in the 1950s under the then Western region called Eredo Maternity to serve the predominantly rural community with mostly agricultural background. It has been the only health facility since then until recently when 4 others were added to the list of health facilities in the area. With subsequent numerous renovations done on the Eredo maternity by both the state and local government at various times in the bid to upgrade it to a standard PHC, the latest renovations have been by the Lagos State government in the past year up until last month, with the approval of His Excellency the Governor of Lagos State, Mr. Babatunde Raji Fashola SAN, who inspired and supported the revitalization program of the primary healthcare system, with the recommendation of the State Executive Council on the primary healthcare system, which was in August of 2011. A major activity identified for the revitalization program was infrastructural upgrade of the 57 primary healthcare centers across the state, with 1 primary healthcare center per local government, local council development area from existing facilities to avoid building new infrastructures. These are called flagship PHCs, and they're based on a 5-point agenda which was delineated by the Executive Council as basic components of a flagship center in the revitalization program. The 15-point agenda include the upgrading of the selected flagship PHC, development of comprehensive referral system, development of primary healthcare human resource system with guidelines and standards of operations, modalities of implementation of community-based health insurance scheme, policy booklets, handbook for the staff and the patients, data management, improved strategy in collation of data, and other services that would improve the healthcare delivery in the flagship. Due to its peculiar location, Eredo LCDA shares boundaries with Ogbere and Ijebu-Ode local governments in Ogun states in the east, Ogbere in the east and west, in the east and north respectively. And the presence of more than 22 towns and villages in the areas have created demands for the healthcare system in the area. Last year, 2012, 97 babies were delivered, 2,262 baby children were immunized, 1,085 antenatal cases were received, 1,575 adults were seen for mostly malaria, 276 family planning services were provided. Since January of this year, when the revitalization program came to Eredo Primary Healthcare Center, 55 babies have been delivered, which is more than half of the babies that were delivered last year, showing an improvement in the services. So far, 1,903 children have been immunized, which is more than half, almost the number that were delivered, that were immunized all of last year. 847 antenatal cases have been seen so far, which is more than half of what was seen the whole of last year. All of this shows that the revitalization program has made a tremendous impact on healthcare delivery in the area. So there have been an increased addition to the staff personnel of the primary healthcare center. The revitalization program increases the number of doctors to 3, so that at any time a patient comes to the facility, 10, we have a laboratory scientist and 3 laboratory technicians, a pharmacist and 3 pharmacy technicians, a medical records officer, 3 medical records technicians. We have clerical assistants, we have health attendants, we have security officers, cleaners, laundry, washmen, and ambulance drivers have all been added to the staff at Eredo PHC. And this is to the effect that the community should be reassured that anytime they come to this facility for healthcare, there will be a doctor, there will be nurses, the lab will be open, you can do your tests, medicines will be available at night, it's 24-hour service. There will be people to issue you cards and all the paperwork that you need, so you don't have to travel. Other services that are provided are general care, which is the adult hypertension. We are screening for hypertension and treating hypertension here now. We're screening for diabetes. We have the finger sugar test. We're screening for urine, sugar in the urine. We're screening for cholesterol, which is another major killer of our elderly people in our society. We're screening for malaria routinely. We're screening for HIV/AIDS and tuberculosis, all free of charge. We're also going to be screening for cancers. For the males, prostate and colon cancers will be screened routinely. Any day you come here, you will be able to get screening on that day. For our women, you should be able to get breast and cervical cancer screening free of charge anytime you come here. Our welfare clinic, it is now, we now have to your left, to my left and your right, you have the new welfare child center that will now do immunization. It used to be part of the old center where everybody is clustered and the services were not well organized because the antenatal and immunization and the sick patients were all sitting together. Now you have service area where you have maternity in one section, the sick patients, adults with malaria in another section, and the children will be here. So the children who need to be immunized are not exposed to the disease of the adult and thereby get sick. We've added the executive chairman is greatly urged and encouraged to support the primary healthcare system with the implementation of the minimum ward healthcare package, the IMSCH, Integrated Maternal Newborn Child Health, and the support for the LGHA, the Local Government Health Authority, the World Health Committee, all the various other committees and teams that work together to make the operations of the facility better for the citizens of the community. This flag-off ceremony serves as a reminder that the local and state government must work together as they are major indispensable partners in creating a sound, accessible, affordable, and sustainable health system in the state. Finally, I wish to commend the executive chairman for lending his full support to this program. This is expected of all our chairmen, and I sincerely hope that we will continue to meet with cooperation as we go on to flag off our PHCs. Most of all, I would like to thank His Excellency for the vision and support to propagate this big scheme that is going to change the way we do health in Lagos State. Before I end, I want to address our people that may not have understood what I've talked about. Ẹ káàsán ẹ̀yin bàbá wa, ẹ̀yin màmá wa, àwọn sísí wa àti àwọn bọ̀dá wa, gbogbo àwọn ará ìlú Eredo ni mo kí pátápátá o. Àwọn màmá wa, mo láti gèlè green yẹn, mo dẹ̀ dúpẹ́ lọ́wọ́ yín, ẹ ti fún mi nìkan nínú ẹ̀ máa èmi náà wé lọ́jọ́ mi ti bá wọ aṣọ tó bá green wọn. ẹ ṣeun púpọ̀. Ní ṣókí nǹkan tí mo sọ ní gbogbo ìgbà tí mo ti ń sọ̀rọ̀ ni pé ilé ìwòsàn kéléje ti Eredo yìí ó ní àwọn àǹfààní tuntun kan tá a tún gbé wá yàtọ̀ sí nǹkan tá a ti ń ṣe níbí báyìí tẹ́lẹ̀. Màá kà á fún yín ẹ̀jẹ̀ ríru tá à ń pè ní high blood pressure kò nídìí kẹ́ máa lọ general hospital mọ́ à ń wò níbí báyìí oògùn ẹ̀ náà dẹ̀ wà níbí báyìí test ẹ̀ wà níbí báyìí ìtọ̀ ṣúgà à ń wò níbí báyìí test ẹ̀ náà wà níbí báyìí àrùn jẹjẹrẹ à ń wò níbí báyìí tá a bá rí i pé ó fẹ́ kù díẹ̀ sí káàtó à ń rán yín lọ sí ilé ìwòsàn ńlá à á fún yín níwèé tẹ́ máa mú lọ tàwọn alábíàmọ́ a ní ìwé kan tá à ń fún wọn maternal booklet tí mo dẹ̀ rí wọn tán ti mú káàkiri wọ́n láti máa gba ìwé yẹn tán bá ti wá fún antenatal mo dẹ̀ fẹ́ wá fi àkókò yìí bẹ àwọn eléwé ọmọ àwọn traditional birth attendants wa wípé a jọ ń ṣiṣẹ́ pọ̀ ní Eredo is a cultural and traditional city is a cultural area kò dẹ̀ sí bá ṣe lè ṣe ọ̀rọ̀ à ń gbẹ̀bí yìí ká má fọwọ́ fa ara wa mọ́ra màá wá fi àkókò yìí bẹ àwọn traditional birth attendants wa pé a ti nawọ́ friendship àti collaboration wa fún yín ẹ jọ̀ọ́ ẹ bá wa gbà kẹ́ bá wa ṣiṣẹ́ pọ̀ kí ọ̀rọ̀ ìgbẹ̀bí ní orí ní Eredo kó bá lè tòrò ká má rí àbíkú ọmọ àti ẹ̀yà mọ́ gbogbo àwọn aboyún wa àní kẹ́ má lọ rí àwọn TBA àní kẹ́ má lọ rí wọn in fact a fẹ́ káwọn TBA yín máa tẹ̀lé yín wá torí a fẹ́ máa fún wọn ní àwọn nǹkan kan tó tún máa fi ràn yín lọ́wọ́ a fẹ́ fún wọn láwọn nǹkan tí wọ́n máa tún fi tọrọ ibi ọ̀rọ̀ ìwòsàn olóyìnbó tó tún máa fi yé wọn sí tó máa fi mọ̀ nǹkan tá à ń ṣe pé kì í ṣe pé à ń ṣiṣẹ́ láti bà iṣẹ́ tiwọn jẹ́ ṣùgbọ́n pé ká jọ ṣiṣẹ́ pọ̀ ni kán máa wá wọ́n máa gba abẹ́rẹ́ àjẹsára nínú oyún ó ní nǹkan tá a ṣe ń fún wọn lábẹ́rẹ́ àjẹsára yẹn wọ́n máa gbógun malaria wọ́n máa ṣe HIV gbogbo àwọn nǹkan báyìí à ní àǹfààní ẹ̀ lọ́dọ̀ àwọn TBA nípa báyìí mo fẹ́ bẹ̀ yín pé tá a bá ti rí pé oṣù ti dúró lára wa tá a bá lọ rí TBA wa kí TBA wa jọ kó jẹ́ ká wá fún antenatal TBA wa kàn ó lè tẹ̀lé wa wọ́n lè tẹ̀lé wa wá bímọ ní bíbá nítorí a rí pé à ń ṣe antenatal bí 100 bí èèyàn bí 20 ló máa padà wá bímọ ìjọba ti ṣe àǹfààní kí ilé ìgbẹ̀bí tẹ̀yìn náà bá wọlé tẹ bá rí ẹ rí pé ìjọba ti náwó rẹpẹtẹ síbẹ̀ yẹn ìdẹ́ ṣe owó ìjọba owó aráàlú owó orí tí à ń pè ní tax òun ló mú ibi báyìí dúró nígbà tá a bá dẹ̀ ti mú owó jáde lápò tá a ti fún ìjọba tíjọba ti lò dáadáa fún wa ó di dandan kí àwa náà kí a pè ká fi ọ̀nà yìí ká fi gba àwọn ará àdúgbò wa nímọ̀ràn ká lè máa wá lo gbogbo àwọn nǹkan tíjọba pèsè fún wa ilé kékeré tẹ̀rí lẹ́gbẹ̀ẹ́ mi bí ní ti ilé abẹ́rẹ́ àjẹsára ibẹ̀ làwọn ọmọ ọwọ́ wa máa lọ láti gba abẹ́rẹ́ àjẹsára Eredo ń gbìyànjú lórí ọ̀rọ̀ ètò abẹ́rẹ́ àjẹsára ṣùgbọ́n ó kù díẹ̀ káàtó ẹ jẹ́ ká máa káwọn ọmọ wa wá ẹ jẹ́ kí wọ́n máa gba abẹ́rẹ́ àjẹsára kò lè pa ọmọ inú wọn kò lè sọ wọ́n di àgàn kàkà bẹ́ẹ̀ ó máa dá ẹ̀mí wọn sí ni ẹ jọ̀ọ́ mo fẹ́ wá bẹ̀ yín ni pé tẹ bá wá tẹ bá rí kókù díẹ̀ káàtó èèyàn kan wò yín wọ́n yín lójú kò dùn wọ́n nínú ẹ bèrè nǹkan kan wọ́n ní kò sí máa fún yín nọ́mbà mi nísìn kẹ text mi kẹ lè mọ̀ pé lóòótọ́ ni ìjọba fẹ́ dúró ti nǹkan tí wọ́n gbé síbi tí a fọwọ́sọ̀yà pé eléyìí kì í ṣe nǹkan tí ẹ ti máa ń rò tẹ́lẹ̀ pé wọ́n kàn máa gbélẹ̀ wọ́n máa lọ ni iṣẹ́ ribiribi ó máa ṣẹlẹ̀ níbí báyìí tẹ́tí ẹ ti mú fóònù nọ́mbà yín bá ní fóònù nọ́mbà mi 0805 ẹ tẹ̀ sínú aago yín 0805 532 9229 ẹ má bẹ̀rù pé èèyàn kan máa lọ gbaṣẹ́ lọ́wọ́ èèyàn kan wọ́n máa léèyàn kan lẹ́nu iṣẹ́ wọ́n máa fẹ́ gbaṣẹ́ èèyàn kan jẹ́ tí ẹ bá sọ fún wa ìjọba kan ló wà ojú kan la wà a lè dé gbogbo orígun mẹ́rin ìpínlẹ̀ Èkó tẹ́ ẹ bá sọ fún wa ànímọ̀ kó ń bàjẹ́ tẹ́ ẹ bá dẹ̀ sọ fún wa ànímọ̀ àtúnṣe sísọ fún wa tẹ́ ẹ sọ fún wa kì í ṣe pé à ń lọ báyàn jà àbá fẹ́ lọ léèyàn lẹ́nu iṣẹ́ ṣùgbọ́n a fẹ́ fi ṣe àtúnṣe ni kí rẹ̀ má bàa wáyé sá 532 9229 ẹ ṣé o àrèrè ń bẹ o á tù wá lára o àníràbíkú o aboyún àgbàbí rẹ á sọ̀rọ̀ o ẹ ṣé o thank you very much kò ní bàjẹ́ o.
I greet you all. the entirety of the health workforce, and the Honorable Commissioner for Health is out of the country. Hello, sir. I just have a few things. The challenge of health is at the grassroots, it's in the community. And the solution to the challenge of health is also at the grassroots, in the community. The gathering that we have today is a step along the road of recognizing this and effecting the prescription. And what is the prescription? The prescription is that everybody who is ill must be able to get care close to where they live. That's one. The second one is that every pregnant woman must be cared for during the course of her pregnancy and at the time of her delivery by skilled birth attendants. And that means those people, that if you are saying everybody, every pregnant woman, that means they shouldn't be looking for, there should not be any part of a great state of Lagos where people have to travel 50 miles to go and look for skilled birth attendants. They should be next door to them. This is one step in effecting that. Another part of the prescription is that our children must be kept alive. They mustn't die before 5 years old or at any time. And what are the things that make them die, and what are the things we need to do not to make them die? They must be immunized. They must be born in safe circumstances. They must be immunized as appropriate. They must be brought up in clean circumstances. Their parents and caregivers must be taught about personal hygiene, so that those people, for instance, mothers must wash their hands when they are handling the babies and things. And that information needs to be imparted to them in a way that is accessible. That is, the people giving the information must be people they know and recognize and see as friends and neighbors. The children must be well fed. The concept of 57 flagship PHCs is a visible way of driving down the message that I've said, that is putting a proper health facility close to everybody in the great state of Lagos. And again, what we are seeing in Eredo today is the actualization of that for the people of Eredo. But it is no use government doing that. There's a part that the citizens need to do. There's no point in, first of all, the flagship is not the buildings. The flagship is the services. The Special Advisor Public Health has told me about the services for the children, for the mothers, and for the generality of the citizens. Please make use of the citizens, of the services. That's what I want to urge people to do. Don't worry about the fine buildings. The buildings are very nice and they look good, and we all feel good when we are in good circumstances. But the most important thing actually is the services that are inside. Please make use of those services. There are places where we have such services where people are not using them as frequently as they should. It is your entitlement, it is your right, it is also your duty to yourselves and to the community to use the services and to encourage everybody. The people in authority, the people who are in respected positions must encourage everybody to use the services. That way, the impact will be felt. The thing about the services we are putting on the ground is that we want it to be of a standard that we can guarantee. For the first time, we are going to be able to say across Lagos, all across Lagos, we have places close to every neighborhood where we can guarantee the quality of service, and that quality of service is very essential. Please pass the message on. I congratulate the good people of Eredo on this achievement and on what we are celebrating today. But the real celebration should be in the fact that we want to see the usage go up. We want to see all the children in the neighborhood that are born in appropriate circumstances, so that children will not die in Eredo, so that mothers will not die in Eredo, so that the quality of life of the good people of Eredo and the generality of Lagosians will be improved. I thank you and I wish you a very good afternoon. But repetition strengthens memory. Ṣókí ohun tí wọ́n sọ fún arígbọ̀n tíjọba pèsè sí bíbáyìí fún àǹfààní gbogbo wa ni. Gbogbo nǹkan tá ń wà lọ general hospital pàápàá ó ti wà ń bí. Ẹ má wulẹ̀ fọṣẹ́ fọ ìrẹsì mọ́, ìrẹsì àrósọ ti wà ńlẹ̀ o. Ètò túmọ̀ sí pé ìjọba ti pèsè gbóhùn tó wà general hospital pátá ló wà ń bí. Ètò bá di pé apá òkà fúnra wọn náà máa sọ ká lọ general hospital, wọ́n ní ẹni tó bá lọ́kọ́ tí ò mèlú ẹ̀ bí ẹni tí ò ní ni. Ẹni tó ládàá tí ò mèlú ẹ̀ bí ẹni tí ò ní ni. Gèlè òdòmé kámọ̀ wé o, gèlè tábà fi sínú àpótí kì í sábà hàn bí ìtàbá wé sórí. Látàrí bẹ́ẹ̀ ẹ jẹ́ ká yọjú sílé ìwòsàn yìí ká ṣe àmúlò ẹ̀ torí tiwa ni wọ́n ṣe ṣe o. Èkó ò ní bàjẹ́ o.
Governor of Lagos State and all other protocols observed. I represent APIN and I bring greetings from the management of APIN and the board members, and we happily congratulate Lagos State and the people of Eredo for this flagging off of this flagship center. APIN is a CDC grant. APIN works with CDC and we have a CTT grant to support the people of this local government. We are going to provide services, HIV services to the people of Eredo, and we support the government in providing machines and drugs free of charge to the people of Eredo. And we, like the SS said, all HIV services that we are providing is free of charge. So if anyone is charging anyone, they can call the SS number. And from the management of APIN, we are wishing the people of Eredo a good use of this facility, and we wish Lagos State government a thumbs up, and we wish they will keep providing good services to the people of Lagos State. Thank you very much.
Gómìnà wa Babátúndé Rájí Fáṣọlá, iṣẹ́ ribiribi tó gbé ṣe lẹ́ẹ̀kejì tó ń ṣe lọ lọ́wọ́ yìí, èyí tó kọ́ ṣe lákọ̀ọ́kọ́ ó ti ẹ̀rù kọ́rẹ́jì gbogbo yọ̀wọ̀ ọmọ Àbújá pé ó gbé iṣẹ́ ìpínlẹ̀ Èkó ṣe nírọ̀rùn pẹ̀lú ọgbọ́n àti òye. Nípa bẹ́ẹ̀ abẹ Ọlọ́run afọlọ́run abùgbẹ́ wọlúwa Gómìnà Rájí Babátúndé ó ní pọ́lísì púpọ̀. Kó tó di gómìnà, millions of Nigerians Lagosian gbogbo wọn wọ́n ti ń lọ sí Amẹ́ríkà, tán ń lọ sí London, tán kàwé ńbẹ̀, tán dẹ̀ ṣe ìjọba Lagos State yìí láwọn ẹni kìnnà ẹ̀dá ọmọ Lagosian tó ṣe gómìnà jíjílẹ̀. Tó bá jẹ́ pé gómìnà ṣe é yálò, àwọn tí òkè ọya wọ́n ti wá gbé láti pàtó. Nípa eléyìí, kì í ṣe wípé iṣẹ́ déédéé yọrí sí rere, bí kò ṣe wípé ọ̀wọ́n fibrous root tó kó mọ́ra. Àwọn fibrous root tó kó mọ́ra, wọ́n ṣe páyà kan fún wọn bọ́ ṣiṣẹ́ ribiribi. Wọ́n bá ṣiṣẹ́, wọ́n ṣe pẹ̀lú òtítọ́ àti àyà ìgbàṣe. Wọ́n ò fẹ́ ní dẹ́ni, wọ́n ò fọ̀lá dọ́là fún un, wọ́n ò dẹ̀ gbé lẹ́yìn dá. Ìyẹn níṣẹ́ ṣe yọrí sí rere. Wọ́n ń ṣe lẹ́nu jẹ, wọ́n ń ṣe 419. Gbogbo wọn jọ pàmpọ̀ àti kọmíṣánná àti pamsec, àwọn ẹni kìnnà bí bẹ́ẹ̀ ló jẹ́ kí iṣẹ́ yìí yọrí sí rere. Olùgbélé iṣẹ́ àṣemọ́ ọmọ di head of state lójú mi.
He's the chairman, House Committee on Information Security Strategy in Lagos State, Honorable Segun Olulade Ebo-Witimit.
Your Excellency, the actualizer, the Cicero of our generation.
Ìṣọ̀lá Anímàṣàun àwọn olùgbàdé ẹlẹ́pẹ̀tì ọlọ́jà àti ẹ̀pẹ́ land ẹ bá ṣe kábíyèsí o. Ọmọ ẹ̀kọ́ olùkọ́ àbàtà, ọmọ onídàá máa jẹ́ kí náà dènìyàn, ọmọ olúyẹ̀kọ́ àbẹ́ adúgẹ̀rẹ́ ọ̀la, kábíyèsí adé apẹ́ lórí o, bàbá apẹ́ lẹ́sẹ̀ o, ètùkàlẹ̀ kẹ́ apẹ́ lọ́rùn o. Bó ṣe gẹ̀rẹ̀ kó mẹ́ẹ̀, ó dàgbà kábíyèsí ọba Babátúndé Ògúnlàjà aládésọ̀rìn ti Nọ́foríjà, ọmọ Nọ́foríjà lágbàrí kó ọmọ ẹ̀yẹ́ fojú ọ̀run ṣòréré, ọmọ olùtarẹ́yẹ tá òrókò tó ẹ̀yẹ́ fò lọ pèrè pé ẹ bá ń ṣe kábíyèsí o. Lẹ́yìn tí wọ́n ẹni tó tẹ̀lé wọn ọba Jí Ògúnsọ̀yà ọlọ́fin àgbá ètò òrúgbò ìtó ọmọ òrùgbò ìdó ìdó ẹgbẹ́gì ọmọ agorí bẹja ọmọ abẹja borí ọmọ abẹja tó fà láàrin ìnáwó ẹ bá ń ṣe kábíyèsí o. ṣé mo gbà á. ẹ tó tẹ̀lé wọn lórí ìjòkó ń bẹ̀ yẹn kábíyèsí ọba adéfowórà mo sọ níbikíbi wọ́n sì máa tún sọ níbikíbi wọ́n sì máa fi ṣe ìyangàn níbikíbi kódà mo ti sọ lọ́wọ́ lójú ọba akíolú ó ní bẹ́ẹ̀ ni lóòótọ́ mo sọ lójú gómìnà fáṣọlá ó ní bẹ́ẹ̀ ni lóòótọ́ wípé gbogbo ìpínlẹ̀ èkó lè ní ọba tó dàbí alákẹ́tù òsì èèyàn dúdú ni gbogbo yín òyìnbó lálákẹ́tù ẹ ṣe kábíyèsí o. lágbàdo yẹn balógun tìlú lára balógun lòdò ń dábà ọmọ alára mọkọ mo kí yín o tẹ́lẹ̀tẹ́lẹ̀ yẹn mo kí yẹn kú jòkó sà ọlọ́run àdúró tì yín o lágbàdo yẹn mo kọjá lọ báyìí former chairman Eredo LCDA yàtọ̀ tí wọ́n ṣe chairman he was a former director general of the Ministry of Education and when he was in office he has a very very sound and good record. What was done instead that majority of individuals of this division, became principal, editors, and majority of them were promoted. Your record is written in gold and will continue to be written in gold. Titi Olayemi, I appreciate you, sir. Congratulations, sir. Next to him is our honorable. Honorable Tambul Adebayo, mo kí ẹ̀rọ tó tẹ̀ kí a dáa. Ọmọ ọba ojú òfin rẹ̀ kù ọmọ àmọ́ gbọ́dọ̀ ọ̀rùn mọ́ wá kó bá wà ọ̀rùn ní gbẹ́rù wọn ẹ bá kàtà fún ọ̀rùn ìjọba fúlàní ìbàdàn ẹkú jòkó sá ẹni tó tẹ̀lé wọn ìdẹ̀ládé lẹ́wọ̀n yẹn ìdẹ̀ládé àdéhùn that is the chairman of the fellow group of gate and you are not planning only those who read law are referred to as family gentlemen here is a lawyer who has been called to the bar a very very long time ago and serve up to the position of a director as well as the council manager before you won an election to become the chairman of the Lekki SCDA. Barrister Allah is not bidon agree to sir. Olú ọmọ gbogbo wa wà ń bí olú ọmọ tìlú Eredo. Ẹ fún látẹ̀wọ́ torí tọ́ ló wà lórí ìdìbò lọ́kàn yìí. Ó mú wọn àbí ò mú wọn? Wọ́n ṣe ẹ̀tù wá dàkún lè pé yẹn ní mú wọn. Bóun ti ń lọ vice yẹn ló wípé gèlè green tẹ́ ìwọ́n lọ́kọ́ yẹn pẹ̀lú aṣọ white yẹn yèyé Olúsọ̀yà mo kì í yẹn káàbọ̀ o ẹ kú dìde o God bless you ẹ kú àlejò wa ẹ̀yin lẹ́ ń gbá mi. Yèyé mo padà sápá abẹ́hùn kábíyèsí lẹ́yìn kábíyèsí olú ẹ̀pẹ́ kábíyèsí olóyè ọ̀dẹ̀dẹ̀ ògbòrò ọ̀tún sẹ́rí kíkánù òkè yín o olóyè sọba lójú nù tó bá sọrun ìlú ẹ̀pẹ́ òkè yín o bàbá wa Ògégbò níbọ̀wọ̀n ó wà pẹ̀lú wa ń bí òun rèé ọmọ ọ̀bọ̀ wọn gbà ọmọ lébe ń bọ̀wọ̀n ọmọ lébe ń ta wọ béèyàn bá gbé lébe irú ẹni bẹ́ẹ̀ ò ní jẹ́ orí ìbọ̀wọ̀n òkè yín o.
Our political leaders, members of the House of Assembly here present and the executive arm, my chairman here, my own message is very, very brief, sir. Your people, the people of Eredo, asked me to tell you to say thank you. Thank you in the constructions of roads, in the provision of good and sound qualitative education, in the provision of good housing scheme, in the provision and the generation of job creations that you have created since March. They asked me to tell you, sir, that the agric years is our pride and it's your pride. We thank you. We thank you for more that we are expecting you to do. We know, like Oliver Twist, we will continue to ask you for more. We are asking today, sir, that we also need a portable water in Eredo SCDA. Your Excellency, sir, proud of you. You are our pride. You are what we see and we celebrate every day. On behalf of these good people of Eredo and the entire Ekpe constituency too, they asked me to sing a song to you, sir, to say happy birthday to you. Happy birthday to you. Happy birthday to you, brother. Happy birthday to you. We wish you long life. We wish you long life. We wish you long life, governor. Happy birthday to you. Thank you, Constituency 2. Thank you, the people of this constituency and Eredo. We appreciate you so much, sir. And we know that with this one that we have provided, so that none of our children will die again, so that we have good health in our communities, so that our people will enjoy free medical primary health scheme. We thank you, sir. We appreciate you. We love you. And by tomorrow that we will clock 50, we wish you that we will clock 60, we clock 70. God bless you. Thank you very much, sir.
Láti House of Assembly, ọ̀rọ̀ ni Chairman's Committee on Information. Àwọn là ń pè ní TAPU, House of Assembly, àwọn kì í ṣe fibrous root.
Well, distinguished guests, His Royal Majesty said, lójú ẹ̀mí wọn, that this young, energetic actualizer of our time will be. Your Excellency, sir.
Mo kí gbogbo wa láti orí bàbá wa Alára Ọ̀fìlára títí lọ dé gbogbo àwọn lọ́balọ́ba. Mo kí aláṣẹ olú iléeṣẹ́ ètò ìlera Mrs. Yewande Adesina. Mo kí gbogbo àwọn aṣojú wa ní ilé àwọn aṣòfin àti Honorable Olúládé àti Àfọ̀ṣẹ́. Mo kí gbogbo àwọn alága wa ní ìjọba ìbílẹ̀, pàtàkì jùlọ Honorable Sabiu Adélájà tó gbà wá lálejò lénìí. Mo kí gbogbo àwọn àgbà ẹgbẹ́ pátápátá. Mo kí gbogbo ẹ̀yin ọ̀dọ́, ẹ̀yin ìyá wa ní Eredo. Mo rò pé èmi máa sún àpèjúwe kábíyèsí yẹn pé àwọn ESCO ní taproot, gbogbo yín pátápátá ẹ̀yin ní fibrous root. Ẹ̀yin lẹ̀ jẹ́ kó bàjẹ́, kò dẹ̀ ní bàjẹ́ lójú wa, kò ní bàjẹ́ lẹ́yìn wa. Mo dúpẹ́ fún yín púpọ̀ púpọ̀ fún orin tẹ́ kọ́ sí ti ọjọ́ bí. Gbogbo wa la máa rí ọdún tuntun, àṣèyí ṣàmọ́dún fún gbogbo wa. Àpẹ́ láyé, ojú wa ò ní rí bí, kò dẹ̀ ní bàjẹ́. Mo rò pé ọ̀rọ̀ mi ò pọ̀ púpọ̀ mọ́. Dr. Yewande Adesina ti ṣe àpèjúwe, ó ti sọ nǹkan tó gbé wa wá bí. Ní ṣókí ẹ̀ ní wípé a lè kó gbogbo ẹyin sínú apẹ̀rẹ̀ kan, torí tápẹ̀rẹ̀ yẹn bá bọ́ ẹ mọ nǹkan tó máa ṣẹlẹ̀ sẹ́yìn. Bẹ́ẹ̀ ni tá bá fìyẹn ṣe àpèjúwe, a lè kó gbogbo ọ̀rọ̀ ètò ìlera sí general hospital àbí sí LASUT. Tó bá ti di pé àìlera díẹ̀, Ọlọ́run má fi àìlera bá wa jà, ó di pé ó yá LASUT, ó yá ní general hospital, la fi ní pé tá a bá tó lẹ́sẹẹsẹ àti ẹ̀ ní mọ̀ wípé bóyá ọ̀nà jì àbí nǹkan kan ṣe, tó bá jẹ́ pé nǹkan tá à ń wá lọ sí Sokoto ní LASUT tá a bá mu wá sápò Sokoto l'Eredo, òun ni ó gbé wa débi báyìí. Iṣẹ́ àwọn ìjọba ìbílẹ̀ ni iṣẹ́ ètò ìlera abẹ́lé, ṣùgbọ́n a rí wípé owó tí wọ́n ń fún wọn láti Àbújá kò lè kárí gbogbo iṣẹ́ tó dìrù wọ́n. Àwọn náà di iṣẹ́ ètò ìdánilẹ́kọ̀ọ́ ti abẹ́lé lé lórí. Tẹ́ bá wo àwọn tíṣà iye tó ń san lóṣù, tẹ́ bá wo báwọn tíṣà ṣe pọ̀ tó, tẹ́ wo báwọn òṣìṣẹ́ iléeṣẹ́ abẹ́lé náà ti pọ̀ tó, ẹ rí i pé torí ẹ̀ la ṣe ní ká fọwọ́sowọ́pọ̀ kí ìjọba ìpínlẹ̀ kó nà wọ́n lẹ́yìn, ká mú àwọn iléeṣẹ́ báyìí wọ̀nyí. Ibòmíì wà tán ní 10, ibòmíì wà tán ní 8, ibòmíì wà tán ní bẹ́ẹ̀ bẹ́ẹ̀ lọ káàkiri ìlú Èkó. Mo rò pé àwọn iléeṣẹ́ ètò ìlera ti abẹ́lé á tó bí 227, ṣùgbọ́n gbogbo wọn kọ́ náà ń ṣiṣẹ́ wákàtí 24 tó bá bẹ̀rẹ̀ iṣẹ́ láàárọ̀, tó bá di bí aago 3 ó di kí wọ́n lọlé. Làwa wá ní tó bá fọwọ́sowọ́pọ̀ pẹ̀lú wa o, a rí pé gbogbo ìjọba ìbílẹ̀ kọ̀ọ̀kan ló ní irú iléeṣẹ́ yìí, at least ẹyọ kan, tó máa jẹ́ pé yàtọ̀ sí iṣẹ́ tí gbogbo àwọn tó kù ń ṣe, àwọn eléyìí wọ́n máa dàbí epo òyìnbó ni wọ́n ní sùn. Àwọn dókítà àti nọ́ọ̀sì àti gbogbo tó bá wà ńbẹ̀ wọ́n máa ṣíwọ́ iṣẹ́ fúnra wọn ní wákàtí 8 ni. Mo dẹ̀ dúpẹ́ lọ́wọ́ gbogbo àwọn olórí ìjọba ìbílẹ̀ tí wọ́n ti fọwọ́sowọ́pọ̀ lórí eléyìí fún wa. A ti sọ pé ìjọba ìbílẹ̀ kọ̀ọ̀kan máa nìkan tó jẹ́ pé a jọ fi ṣe àfọwọ́sowọ́pọ̀. Èyí tó kù ìyẹn dẹrù wọn, wọ́n máa gbé yẹn, ṣùgbọ́n eléyìí á jẹ́ gẹ́gẹ́ bí àpẹẹrẹ. Mo rò pé tó bá ti rí báyìí, ó di 5. Ìgàdúgọ̀ràn láti bẹ̀rẹ̀ láàrin ìlú Èkó, a kúrò ńbẹ̀, a lọ sí Mọ́sọ̀pọ̀ lálìmọ̀ṣọ́. Nígbà tá a kúrò ńbẹ̀, a lọ sájàrá ní Badagry, a wá lọ sí Èjìrẹ́ ní Tìrẹ́. Eléyìí ló jẹ́ 5 ní Eredo. Lágbára Ọlọ́run 63 tá a lérí ẹ̀, Ọlọ́run á bá a ṣe. Gbogbo ètò ìlera tí ó wá wà bí pàtàkì jùlọ tí àwọn aláboyún, àti rí i pé wọ́n bí wẹ́rẹ́ ká máa gbóhùn ìyá ká máa gbóhùn ọmọ. Wọ́n ti ṣàlàyé bó ṣe máa ṣẹlẹ̀ fún wa. A ti nawọ́ ìfọwọ́sowọ́pọ̀ pẹ̀lú àwọn ìyá wa àti bàbá wa tó ń ṣe ètò ọmọ bíbí, tó ń lo ewé ọmọ. Àṣà abínibí ni a lè kọ̀ sẹ́yìn, ṣùgbọ́n Ọlọ́run ti fún àwọn kan ní òye láti tún rí i pé èyí tá a ti mọ̀ tẹ́lẹ̀ yẹn ó lè fọwọ́sowọ́pọ̀ mọ́ èyí tí ó ti ṣẹlẹ̀ ní. Tá bá wò ó gẹ́gẹ́ bí àpẹẹrẹ, ṣé bígbà kan rí ẹṣin là ń gùn, ìgbà kan rí ọkọ̀ gbàdígbàdí là ń wọ̀, àwọn kan wá ṣe mọ́tò, ṣé a fọwọ́sowọ́pọ̀ pẹ̀lú mọ́tò ká máa lò ó? Nítorí náà èyí tí àǹfààní tó ìbò ṣe ń sìn tó yẹ pé a lè máa wo bọ́mọ ṣe ń mí, wọ́n ti ṣe ẹ̀rọ ẹ̀wá, ó máa rọ àwọn tó tiẹ̀ ń gba ẹ̀bí ní àṣà abínibí lọ́wọ́, torí wọ́n ti mọ̀ pé kò sí nǹkan kan tó ṣọmọ yẹn. Bẹ́ẹ̀ eégún bá tiẹ̀ yẹ̀, a ti ní ẹ̀rọ tó lè wo bí téégún yẹn ti yẹ̀. tó bá tiẹ̀ máa jẹ́ pé àwọn tí ó ń ṣe ètò egun náà ni tóun náà bá wò á mọ ibi tó ti yẹ á mọ bó ṣe máa yí ṣùgbọ́n láì mọ̀ ó máa ṣe bó bọ́ sí bí ò bọ́ sí ni nítorí náà mi ò rò wípé àṣà ti olóyìnbó ó kẹ̀yìn sí ti àṣà abínibí wa méjèèjì ló ṣe é fọwọ́sowọ́pọ̀ láti rí i pé aboyún òbí wẹ́rẹ́ ká gbóhùn ìyá ká gbóhùn ọmọ ṣùgbọ́n pàtàkì jùlọ bẹ́ẹ̀ máa ń kí àwọn kábíyèsí wípé àwọn olórí a máa ṣiṣẹ́ ìbí ṣùgbọ́n máa ń rọ̀ wọ́n mo dọ̀rọ̀ pé ìyá wa màmá wa ìyáàfin Ọ̀tẹ́dọ́lá wọ́n á kì mí lẹ́yìn bíi pé ó yẹ káwọn kábíyèsí náà rọra máa kì mọ́ nítorí pé àwọn kábíyèsí náà gẹ́gẹ́ bí àgbàlagbà ló máa ń kí àwọn obìnrin pé wọ́n kú ewu tá a bá dẹ̀ wo nǹkan tó ń jẹ́ ewu téèyàn kan bá di èèyàn méjì nígbà míì ó lè di èèyàn mẹ́ta ó ti ń dèjì rẹ́ ni àbí bẹ́ẹ̀ kọ́ ó dẹ̀ lè di mẹ́rin ẹni tọ́lọ́run bá yọ nínú ewu yẹn kú ewu lóòótọ́ ìgbà míì àwọn ọkùnrin máa wá ní ó bímọ obìnrin ló bí kò bí ọmọ ṣé èèyàn á rí Dr. Yewande Adésínà yà á lòun ò rọ́mọ àbẹ́yàn á rí gbogbo àwọn màmá wa tó lóyè lè wá láwọn ò rọ́mọ gbogbo nǹkan tóbìnrin lè ṣe ọkùnrin lè ṣe gbogbo nǹkan tọkùnrin lè ṣe obìnrin lè ṣe pàtàkì jùlọ àwọn ọkùnrin láti wá nawọ́ sókè àìbí ọkùnrin kì í ṣẹ̀bi obìnrin nǹkan tó ń fa ọkùnrin bíbí ọwọ́ ọkùnrin ló wà bẹ́ẹ̀ ni ẹlẹ́mi mo sọ bẹ́ẹ̀ àwọn dókítà adẹ́kì mi lẹ́yìn àbí dókítà báwo ni wọ́n pè é ní X and Y chromosome ọkùnrin ló ní X and Y obìnrin X méjì ló ní so kó tó lè dọkùnrin ọkùnrin láti ju Y tiẹ̀ lẹ̀ fóbìnrin kó lọ pàdé X méjì tó wà bẹ́ẹ̀ kó mú kan nú ẹ̀ kó dọkùnrin so tóbìnrin ò bá bí ọkùnrin kì í ṣẹjọ́ obìnrin ẹjọ́ ọkùnrin ni òun ni ò ju Y yẹn lẹ̀. mo ti kọ́ yẹn ní biology tipẹ́tipẹ́ nítorí náà ìwọ̀ntúnwọ̀nsì ni ṣùgbọ́n kókó ẹ̀ ni pé a ní láti tún fi ètò sí ọmọ bíbí bó tilẹ̀ jẹ́ pé ètò ìtọ́jú wọn ti wá wà nítorí wá lọ di 10 tó bá lọ di 20 torí balẹ̀ eléyẹn lè máa wá fẹ́ ìyàwó 4 owó ẹ̀ ò dẹ̀ lọ sókè ibi tí wàhálà ti máa ń bẹ̀rẹ̀ nìyẹn lórí eléyìí wọ́n ní wọ́n ń ka ọmọ fọlọ́mọ ṣùgbọ́n káwa náà fi ètò sí ká lè rí agbára àti gbogbo nǹkan tá a máa fi tọ́ wọn ṣe wá rí wàhálà àwọn ìyá wa ló tiẹ̀ wá pọ̀ jù wọn ń bímọ kọ́kọ́ díẹ̀ torí wọ́n máa ṣàbíamọ títí dọjọ́ alẹ́ ni so tó bá wá bí bíi 5 táwọn ọmọ ẹ wá bẹ̀rẹ̀ sí ní bímọ wàá máa gbọ́ ẹ lágbájá ti bímọ mò ń lọ jókòó tì í tàbẹ̀nu ti bímọ mò ń lọ jókòó tì í tó bẹ́ẹ̀ bá ṣe bí náà ni wàhálà yẹn tún ṣe máa pọ̀ o wọ́n máa ní ẹkú ọwọ́ lómi lọ́tún ẹkú ọwọ́ lómi lọ́sì ọlọ́run á bá wo gbogbo àwọn ọmọ náà o wọ́n á dàgbà wọ́n á darúgbó wọ́n á ṣe oore lójú ẹ̀mí wọ́n á di gómìnà wọ́n á di president o. Distinguished ladies and gentlemen, I am happy to be here today to come and flag off this flagship primary health care center, and I'd like to commend the host chairman, Honorable Sabiu Adelaja, who has embraced the collaborative initiative by the state government to assist local governments develop at least one flagship center across the 57 local governments and local council development areas. I'd like to also commend the Ministry of Health and to particularly acknowledge the leadership and commitment provided by Dr. Mrs. Yewande Adesina in the way that she has taken responsibility for this, giving her phone number in public, urging you to complain if the service level drops. That for me is leadership from the front, that we will not walk away from any facility that we deliver. But I like to urge all of us, community members, community leaders, local government chairmen, councillors and all, that this is your asset. It looks beautiful today, but it will require, for example, from time to time to be painted. It will require from time to time to be maintained. And it will not stay like this unless we keep the hand on it. What we seek to achieve is to build a referral healthcare system that moves from a robust and intensive grassroots healthcare, starting from a 24-hour service delivery at the various local governments through to the general hospital up to our teaching hospital. This is the only way that we can fully integrate, we can redistribute our assets and optimize them. If we put all the eggs in one basket and everybody heads to Lasut in Ikeja for every small ailment, the healthcare system will not serve our needs. A referral system disaggregated through the primary to the secondary and the tertiary level is the model that has succeeded in every part of the world, and it is the model that we are committed to apply here to make healthcare a local success here. The ambulance system will enable patients to be transferred from the primary healthcare system to the secondary healthcare system and to the tertiary healthcare system depending on the need. As this system takes root, there will come a time where no doctor will attend to you in the general hospital or in the teaching hospital unless you have a referral note from your primary healthcare center.
Thank you, bro.
If you go to the United Kingdom today, no doctor in any specialist hospital will attend to you until you have a reference from your general practitioner. So those things you have gone to look for in England is now in your local government. This is your GP. So please use it so that we can deepen the access for mothers and children and also for adults. All sorts of screening for diabetes, for tuberculosis, for cancer, and all of that have been provided here. So there is no need for anybody to travel a distance. So from today, we commit to making grassroots healthcare a local matter in Eredo. From today, the treatment of malaria, vaccination of our children, antenatal care, delivery of normal births will become a local matter in Eredo. From today, we begin to lay the solid foundation for a referral healthcare system predicated on an intensive and robust primary healthcare that goes from primary to secondary and to tertiary healthcare. From today, we lay a very solid foundation for our commitment to discharge our primary obligation to protect lives and property. I thank you all very much for your attention. God bless you.
And so from today is that we take care of all our needs at all times.
Don't stand on the road. Don't stand on the road. Thank you. Please don't stand on the road. Don't stand on the road. Please. Who are you? Please don't stand on the road. Give us a
Sorry, GPS. Sorry.
díẹ̀.